Understandably, when someone's undergoing elective surgery, something they choose to do, not because they have to do, worrying about the scar is going to be the biggest concern that anyone has. And everyone wants to know how to reduce the scarring. Well, I'll tell you a dirty little secret. Plastic surgeons probably get too much credit for their good scars and too much blame for their bad scars. Reminds me, my father always jokes, parents take too much credit for their children's success and too much blame for their children's failure. It's another factor that we don't understand. It's really your biology more than anything else that will determine the quality of your scar. Precise technique by the surgeon, gentle handling of the tissues, gently placing in just the right number of sutures and not making them too tight, using quality sutures that cause less irritation of the tissue, all of that matters. But I have my own patients where I've done the exact same operation on even sisters, and one has a nearly invisible scar and one has a thicker scar. So I do everything that I'm aware of to minimize the setup I give a patient for scar formation. I ask them after surgery to either rub ointments or creams on it, though none of those creams, not a single one, has been tested and been proved to do anything for a normal person. Some of these creams have been shown to work in people who already have bad scars. But no one has shown that routinely using these scars on these creams on every patient will make a difference. But still, just in case, I do suggest that patients rub this stuff on, and there's some that we sell in the office and some that I'll tell patients they can get at a pharmacy. If, though, the scar starts to look red or thick worse than usual, and that's the reason why I like to see patients frequently after surgery, I'll refer you to a dermatologist who can do a laser treatment on the scar so we beat the scar down early so that we do everything we can to make the scar good. So most of the time, scars are very inconspicuous. I always place scars in a natural crease or a natural line, or I curve them because the eye really sees diagonal and straight scars, but just a little curve in the right place, gentle handling of tissues, usually we end up with a great scar.